commonly known as whooping cough, is caused by Bordetella pertussis. The pertussis bacteria enter the lungs and cause swelling and irritation in the airways, leading to severe coughing fits. It spreads very easily, and people who have the infection can still spread to others for weeks after they become sick. The infection is spread through droplet transmission and direct transmission. When an infected person coughs or sneezes, bacteria containing droplets get into the air. 75% of babies get infected by parents or siblings who have less severe infection without the typical cough. Early symptoms are shown in the first to second week of infection include mild cough, runny nose, low-grade fever, and infants may have apnea or pause in breathing. Symptoms after 2 weeks to 12 weeks include rapid coughing fits, followed by a loud, high-pitched whooping sound on breathing in, vomiting, typically after a coughing fit, tired feeling after coughing fits, and poor sleep.
A doctor will give the person infected an antibiotic to treat the infection. Sometimes the infection is so severe that the treatment needs to be given in the hospital. Babies are at a high risk for needing to get treatment in the hospital. Oxygen and intravenous fluids may be needed to severe coughing spells. People living in the household and other close contacts are usually also given antibiotics even if they are not yet sick when there is a person with pertussis, as it is so easily spread. According to the Centers for Disease Control and Prevention, worldwide, there are an estimated 16 million cases of pertussis and about 195,000 deaths per year. In 2010, out of the U.S. population of 308 million people, there are about 27,500 reported cases of pertussis, including 27 deaths, and with 25 occurring in infants under age 1. Children should get 5 doses of DTaP, 1 dose at each of the following ages: 2, 4, 6, and 15 through 18 months, and 4 through 6 years. Tdap is a booster shot for adults and adolescents working with children. Adolescents 11 through 18 years of age, preferably at age 11 to 12 years, should receive a single dose of Tdap. 1 dose of Tdap is also recommended for adults 19 years of age and older who did not get a Tdap as an adolescent. Expectant mothers should receive Tdap during each pregnancy, preferably at 27 through 36 weeks. Tdap should also be given to 7 to 10-year-olds who are not fully immunized against pertussis. Tdap can be given no matter when Tdap was last received.
The vaccines are made by chemically treating the diphtheria, tetanus, and pertussis toxins to render them non-toxic, yet still capable of eliciting an immune response in the vaccinated person. They are known as inactivated vaccines because they do not contain live bacteria and cannot replicate themselves, which is why multiple doses are needed to produce immunity. The pertussis component of the Tdap vaccine is purified from the B. pertussis bacteria and then inactivated. Many people believe that the combined vaccine against diphtheria, tetanus, and pertussis and the vaccine against poliomyelitis cause sudden infant death syndrome. There is no causal link between the administering of the vaccines and sudden infant death syndrome. However, these vaccines are administered at a time when babies can suffer from sudden infant death syndrome. It is important to remember that these 4 diseases are life-threatening, and babies who are not vaccinated against them are at serious risk of death or serious disability.
Some side effects of the Tdap and DTaP vaccines include pain, redness, or swelling at injection site, mild fever, headache, tiredness, nausea, vomiting, diarrhea, stomach ache, chills, sore joints, body aches, rash, or swollen glands. The Tdap vaccine is available at local pharmacy clinics and costs about $64 to $65 per dose. The DTaP booster shot costs between $55 and $100. Medicaid covers vaccines for pertussis per the recommended immunization schedule. Medicare coverage for Tdap vaccination is Part D benefit. This is a prescription drug benefit, so coverage for Tdap may depend on use of that benefit so far this year. If Medicaid covers a vaccine, Medicare pays. If Medicare does not, Medicaid becomes the primary insurance. The Tdap vaccine product must be stored at 35 degrees to 46 degrees Fahrenheit. They should not be frozen or exposed to freezing temperatures.